Assalamualaikum. My name is Arisha Sofia binti Azhar and I am from SR113-2D1, no metric 2021109643. My lecturer's name is Muhammad Sufyan bin Muhammad Zaki. So today I want to present you about cardiovascular system. Table of content, we have introduction, structure, anatomy, function of cardiovascular system, blood flow of cardiovascular system, abnormal condition of heart, and conclusion. Introduction of cardiovascular is cardio is a heart and vascular is a blood vessel. Next have three main organs which is heart, blood vessels, and blood. Cardiovascular also distribute blood flow throughout to the body. I will share you about anatomy of the cardiovascular system. As we can see here, our heart have four chambers, which is right atrium, right ventricle, left atrium, and left ventricle. Each chamber separated by a four valve, which is pulmonary valve, tricuspid valve, mitral valve, and aortic valve. We also have pulmonary artery that carry the oxygenated blood to the lungs for external diffusion, while pulmonary vein carry oxygenated blood from the lungs backward to the heart. We also have the outer and superior vena cava and inferior vena cava. There are many functions of cardiovascular, which is cardiovascular transport hormone to receptor. Cardiovascular supply oxygenated blood to all parts of the body and carry the oxygenated blood back to the lungs. It also brings nutrients and all good things to every cell in your body. Other than that, it will maintain body temperature and blood buffering capacity. In this slide, I will show you about blood flow in cardiovascular system. The deoxygenated blood will enter from superior vena cava or inferior vena cava throughout the right atrium. When the oxygenated blood at the right atrium, tricuspid valve is open and pulmonary valve is closed, and then they will go through to the right ventricle, and then pulmonary valve is open, tricuspid valve is closed. The deoxygenated blood will enter the pulmonary artery to the lungs for external diffusion. After the external diffusion happens, it will enter from pulmonary vein that carry oxygenated blood go through to the left atrium. From that, mitral valve is open and aortic valve is closed. And then they will go through to the left ventricle, and then the aortic valve is open and mitral valve is closed. The oxygenated blood will enter the aorta, and the aorta will supply the oxygenated blood to all of part of your body. Next, we have abnormal condition of heart. Heart failure can occur due to a variety of factors related to the heart or other organs. Among the causes that contribute to heart failure include coronary artery disease, arrhythmias, and high blood pressure. This problem usually causes the heart muscle to work harder to pump blood throughout the body. Over time, this heart muscle will become a thick or weak and will no longer be able to hold on properly. Next, we have heart valve disease. Like I just said just now, our heart have four chambers and each of chambers is separated by a valve. If a valve doesn't open properly or doesn't close properly, both of these problems can be caused by a variety of things such as infection or inflammation of the valve, and again, untreated heart valve disease can lead to the heart failure. The conclusion is cardiovascular system is the main structure in our body that can cause any disease if we not take good care of it. Cardiovascular also the place where the heart distributes oxygen by the blood flow to our body. If the artery keep pumping and the blood did not go through until the end of the artery, it can lead a heart attack too. Everyone wanted a smooth blood flow for their body to prevention. My suggestion, we need to know our heart rate by using smartwatch or do some exercise to keep our heart more healthy and to prevent from any disease. That's all from my slide. So thank you for listening and assalamu alaikum.